I took care of a young girl who would only have a seizure for some reason when she would look at an open refrigerator. As bizarre as it sounds, the way our brains are wired is something that we're continuing to learn about, but is yet a mystery in some ways too. My name is Mian. I'm a neurosurgeon in Denver with CarePoint Neurosurgery and Spine, and I practice at Swedish Medical Center. I went to Harvard Medical School and then did my residency training at Massachusetts General Hospital. So as a medical student, I did a rotation at a pediatric hospital in Uganda. I remember one day when I was on call in the clinic, a young mother brought in her baby girl. It's probably no more than a year old. And the mother was telling us that the little girl was lethargic and she wasn't eating anymore. I noticed that she had a down gaze. Her eyes were looking downward. And I knew this was an ominous sign. So we did an ultrasound of her brain, and it turned out that there was a mass or growth of some kind deep inside the brain. By the time the evening came around, she was no longer able to breathe on her own. So we had to insert a breathing tube. But we were in a pretty resource-limited setting, so it meant that there wasn't a ventilator available for her overnight. We had no option but just to what's called bag ventilate, to force air into her lungs. And so I remember I stayed with that little girl and, well, maybe I'll start over. Lacking a better option, I stayed at her bed that night and just continued breathing for her, squeezing that bag. That experience of feeling helpless and not having a set of tools to help someone in front of you, it left an impression on me. And I think it was a big part of what drove me to want to become a neurosurgeon. I think what appealed to me about being a surgeon is that in that moment, I have a set of tools, a set of skills to be able to change the shape of where this patient's life is going. My name is Mian. This is my dark water story.